The epidemic emerged around 1917 to 1918. This emergence coincided with the influenza pandemic. Archival footage and documents help establish this timeline. These historical records provide key insights into the pandemic's origins. Early symptoms include fever, headache, and fatigue. The disease rapidly progresses from initial symptoms. Patients transition into a sleep-like state. Doctors in the early 20th century are examining patients. The examination focuses on the progression of the disease. The 1920 saw widespread epidemics that severely strained healthcare systems. Hospital wards were often overcrowded, reflecting the high number of patients. Many patients were in deep sleep, indicating the severity of their conditions. The scale of the epidemic highlighted the urgent need for medical resources. Healthcare providers faced immense pressure due to the overwhelming patient load. Early neurological research focused on understanding diseases affecting the brain. Scientists aimed to examine the impact of diseases on the nervous system. These examinations were conducted in neurological research labs. The goal was to understand the underlying mechanisms of neurological disorders. These early efforts laid the groundwork for modern neuroscience. Encephalitis lethargica's global spread is visualized on an animated map. The map highlights the regions affected across Europe. Affected areas in North America are also indicated. The animation further illustrates the spread to regions in Asia. Researchers employ microscopes to examine brain tissue samples. The microscopic analysis aims to identify potential viral agents. The analysis also seeks to detect bacterial agents within the tissue. The goal is to determine if these agents are responsible for the illness. This scene depicts patients in a long-term care facility. These patients have survived an initial critical phase of illness. They now face chronic neurological conditions. One example of such a condition is Parkinsonism. Long-term care focuses on managing these ongoing health challenges. In the 1930s, neurologists and researchers convened to discuss encephalitis lethargica. The conference aimed to share the latest findings related to the disease. Various theories surrounding encephalitis lethargica were examined. A key challenge was the absence of definitive answers regarding the disease's cause and treatment. The lack of understanding underscored the complexity of encephalitis lethargica. The discussions highlighted the ongoing need for further research and investigation. Medical historians and neurologists are currently investigating the encephalitis lethargica epidemic. The epidemic remains an unsolved medical mystery. Researchers are focusing on the unique characteristics of the disease. Interviews with experts provide insights into the historical context. The goal is to understand the causes and potential future outbreaks. Modern brain scans are utilized to investigate the effects of a specific disease. These scans are compared with historical brain data to identify affected regions. The analysis focuses on pinpointing specific areas of the brain impacted by the disease. Identifying these affected regions provides clues about the disease's pathogenesis. This comparative approach aids in understanding how the disease develops and progresses within the brain. Genetic studies are performed to investigate the factors influencing susceptibility to encephalitis lethargica. These studies aim to identify potential genetic predispositions associated with the disease. Researchers explore whether specific genes increase an individual's likelihood of developing encephalitis lethargica. Viral interactions are also examined as possible contributors to the disease's development. The goal is to understand how genetic factors and viral exposures may interact to influence susceptibility. Immunological research investigates potential causes of neurological damage. The research focuses on autoimmune responses as a possible explanation. Viral triggers are also examined as potential causes. The goal is to determine if these factors contribute to observed neurological issues. Survivors face significant challenges reintegrating into society after an epidemic. Many experience persistent neurological effects impacting daily life. Psychological effects also present obstacles to full recovery and social reintegration. Archival footage documents these struggles, highlighting the long-term impact of the epidemic. Medical research continuously investigates disease etiologies. The etiology of some diseases remains elusive despite ongoing efforts. Textbooks highlight the complexities of identifying disease causes. Research aims to clarify the factors contributing to disease development. Uncertainty in etiology underscores the need for further investigation. Symptom visualization illustrates the effects of encephalitis lethargica on the brain. Visual representations highlight the specific brain areas affected by the disease. These visualizations may show potential disruptions to neurological pathways. Affected areas and disrupted pathways are key to understanding the disease's impact. Modern research facilities are dedicated to finding solutions for current and future health challenges. These facilities symbolize the ongoing quest for knowledge and understanding of diseases. A key aspect of this research involves studying past epidemics to identify patterns and vulnerabilities. Analyzing historical outbreaks provides crucial insights into disease, transmission, and control. Understanding past epidemics is essential for developing effective strategies to manage future health crises. This proactive approach enhances our preparedness and resilience in the face of emerging health threats.